In a lot of disadvantaged communities, people don't actually die from rare or complex diseases. They die from things that could have been prevented. And the reason isn't because they don't care about their health, it's because healthcare just isn't accessible. Hospitals are hours away, regular checkups are too expensive, and when you live day by day, just trying to put food on the table, prevention isn't the priority. So what happens? Something as simple as diabetes, tuberculosis, or even an infection gets ignored until it becomes life threatening. By then, it's either too late or far too costly to treat. Families end up losing loved ones not because of the disease itself, but because they never had the chance to catch it early, and that cycle just keeps repeating generation after generation. Let me paint a picture. Imagine a small rural village. There's no hospital nearby. If you want to see a doctor, you've got to travel hours down rough, dusty roads. And that trip alone costs money that families just don't have. So people wait, they say. I'll go next month. I'll go when I can afford it. But by the time they finally do, the disease has already taken hold. Now think about what that means for a family. Parents can't work because they're sick. Kids miss school because they're caring for their parents or sick themselves. The whole community is held back not because they don't want to be healthy, but because the system is stacked against them. So here's the question: what if we flip the system around? Instead of making people chase healthcare, why don't we bring healthcare to them? I imagine mobile clinics that run completely on solar power, so they don't rely on expensive electricity or patchy infrastructure. These clinics drive directly into communities and offer low cost or free screenings. Inside, they're equipped with AI powered diagnostic tools that can scan for diseases quickly and cheaply. That means even a small team of health workers could check hundreds of people in a single day. It's simple but powerful. Instead of waiting for people to travel for hours and pay money they don't have, the clinics come to them, powered by the sun, and give them the prevention they deserve. But to really make this work, it has to be sustainable. Here's how I picture it: families pay a small subscription fee, just a couple of dollars a month, and in return, they get unlimited screenings whenever the clinic comes to their community. For most families, that's less than the cost of a meal, but it could save their lives. Businesses and NGOs could also step in. Think about a farm, a factory, or even a mining company that employs hundreds of workers in rural areas. Instead of losing productivity when workers get sick, these companies could pay for bulk coverage to keep their workers healthy. Schools could do the same, making sure kids are screened regularly so they don't miss out on their education. And if someone does need more advanced treatment, the clinic doesn't just stop there. It connects them to the nearest hospital or specialist. That way, prevention stays affordable, families stay healthier, and the system pays for itself over time. The impact of something like this is massive. Children get the chance to grow up healthier because diseases are caught early. Parents don't have to choose between putting food on the table or getting checked. And communities finally break out of that cycle of preventable sickness. It's not about fancy healthcare. It's not about fancy technology in big cities. It's about fairness. It's about giving every community, no matter how far away they are, the basic right to stay healthy. Imagine the difference. A child who would have lost their parents to an undiagnosed disease now gets to grow up with them. A farmer who would have lost their livelihood to illness can keep providing for their family. And a whole community, instead of being stuck in survival mode, gets the chance to thrive. Now, I'm not saying it's going to be easy. There are challenges: funding, staffing, building trust within communities. But with the right partnerships, schools, local leaders, NGOs, even governments, this idea can grow into something sustainable. I really believe that prevention is power. When you give people the chance to catch diseases early, you don't just save lives. You give families more time together. You give communities a fair shot at a healthier future. And to me, that's worth building.